Okay, let's work on learning neurology and endocrinology medical terms. You should have already worked through building neurology and endocrinology terms in your book. For neurology terms, you'll begin on page 297, and endocrinology terms, you would begin on page 322 if you're using the third edition. If you haven't done that already, stop the video now, go back and do that, and then come back here and we'll work through a sampling of terms. Let's begin with neurology. A term that means cerebellum inflammation is cerebellitis. A term that means protrusion of the meninges is meningocele. Pertaining to cerebrum, cerebral. Abnormal softening of the cerebrum, cerebromalacia. And hardening of the cerebrum, cerebrosclerosis. An electroencephalogram is a record of the electricity of the brain. Encephaloma is a brain tumor. Anesthesia is a condition of being without sensation. Hyperesthesia is a condition of having excessive sensation. Medullary means pertaining to the medulla oblongata. Meningomyelitis is a meninges and spinal cord inflammation. Myelography is the process of recording the spinal cord. Myelotomy is the cutting into the spinal cord. Polyneuritis is the inflammation of many nerves. Neurorrhaphy is to suture a nerve. Hemiparesis means half weakness. Aphasia means without speech. Dysphagia is difficulty or abnormal speech. Plegia is a suffix that means paralysis. Paralysis of one limb is monoplegia. Half paralysis would mean hemiplegia. Pontine means pertaining to the pons. Pontocerebellar means pertaining to the pons and cerebellum. Radiculitis is the inflammation of a nerve root, and radiculopathy is a nerve root disease. Thalamic means pertaining to the thalamus, and thalamotomy is cutting into the thalamus. All right, let's work through neurology vocabulary. Alzheimer's disease is a chronic brain condition that involves progressive disorientation, speech and gait disturbances, and loss of memory. ALS, or amyotrophic lateral sclerosis. This is a disease with muscular weakness and atrophy due to the degeneration of motor neurons in the spinal cord. It's commonly called Lou Gehrig's disease. An analgesic is a drug used to treat minor or moderate pain without the loss of consciousness. An anesthetic is a drug that produces a loss of sensation or the loss of consciousness. An anticonvulsant is a medication used to reduce the excitability of neurons and to prevent uncontrolled neuronal activity that's associated with seizures. Bell's palsy is a one-sided facial muscle weakness or paralysis, and it's usually temporary. A brain tumor is an intracranial mass, and it can be benign or malignant. A benign tumor of the brain can still be fatal because it'll grow and cause pressure on normal brain tissue. Cerebral angiography is a diagnostic X-ray of blood vessels of the brain after the injection of a radiopaque dye. And a cerebral contusion is the bruising of the brain from impact. Symptoms that last longer than 24 hours and include unconsciousness, dizziness, vomiting, unequal pupil size, and shock. Cerebral palsy, abbreviated CP, is a non-progressive brain damage resulting from a defect in fetal development or trauma or oxygen deprivation during or shortly after birth. The symptoms might be mild or severe and may include a variety of muscle power and coordinating problems, ranging from paralysis to uncontrolled spasms, depending on the location of the damage. Cerebrospinal fluid analysis, we abbreviate this CSF, is a laboratory examination of the clear, watery, colorless fluid within the brain and spinal cord, and it detects infection or bleeding of the brain. A cerebrovascular accident, CVA, is the development of a brain infarct due to the loss in blood supply to the brain. It can be caused by the rupture of blood vessels, called a hemorrhage, a floating blood clot, called an embolus, a stationary clot called a thrombosis, or compression. The extent of the damage depends on the size and location of the infarct and can include dysphagia and hemiplegia. It's also commonly called a stroke. Chronic traumatic encephalopathy, or CTE, is a condition characterized by a severe blow or repeated, less severe blows to the head that results in progressive degeneration of brain tissue, and it has been identified in athletes of contact sports, especially football players. Coma is a profound unconsciousness or stupor resulting from an illness or injury. Computed tomography, or a CT scan, is a diagnostic image technique that produces a cross-sectional view of the body. The X-rays taken from multiple angles are compiled by a computer to construct a composite cross-sectional view of the body. A concussion is an injury to the brain when the brain is shaken inside the skull because of impact. Symptoms are usually temporary and may include headache, dizziness, nausea or vomiting, unequal pupil size, blurred vision, balance problems, and shock. A convulsion is a severe involuntary alternating muscle contraction and relaxation, and it has a variety of causes such as epilepsy, fever, and some toxic conditions. Delirium is an abnormal mental state characterized by confusion, disorientation, and agitation. Dementia is a progressive impairment of intellectual function that interferes with performing activities for daily living. Patients have little awareness of their condition, and they're found in disorders such as Alzheimer's disease. Epilepsy is a recurrent brain disorder that causes seizures and loss of consciousness as a result of uncontrolled neuronal activity. Guillain-Barré syndrome is a condition in which some nerves lose their myelin insulation. Symptoms include loss of sensation or muscle control, starting in the legs. Symptoms then move towards the trunk and may result in paralysis of the diaphragm. Hydrocephalus is the buildup of cerebrospinal fluid within the brain. If congenital, it causes the head to enlarge, and it's treated by creating a shunt from the brain to the abdomen to drain the excess fluid. A lumbar puncture is a puncture with a needle into the lumbar vertebra, usually the space between the fourth and fifth lumbar vertebra, to withdraw fluid for examination or for injection of medication. It's also called a spinal puncture or a spinal tap. A migraine is a specific type of headache characterized by severe pain, sensitivity to light, dizziness, and nausea. Multiple sclerosis, or MS, is an inflammatory autoimmune disease of the central nervous system. The immune system damages the myelin around the neurons, making certain areas of hardened tissue called plaques. And this results in vision problems, pain, weakness, and abnormal sensations. Typically, sensations go through alternating periods of improvement and worsening. Myasthenia gravis is also an immune disease with severe muscular weakness and fatigue due to the difficulty of electrical impulses passing across the synapse from one nerve to the next. Narcotic analgesic is a type of drug used to treat severe pain, and it has the potential to be a habit forming. It's also called an opiate. Nerve conduction velocity, or an NCV, is a diagnostic test to determine if nerves are damaged by recording rate at which an electrical impulse travels across a nerve. If the nerve is damaged, the velocity is decreased. This is also called a nerve conduction study, or NCS. Paralysis is the temporary or permanent loss of muscle function and movement. Parkinson's disease is a chronic disorder of the nervous system with fine tremors, muscular weakness, rigidity, and a shuffling gait. Positron emission tomography, or PET, is a diagnostic imaging technique that uses positive radionuclides to reconstruct brain sections. Measurement of oxygen and glucose uptake, cerebral blood flow, and blood volume can be taken, and the amount of glucose the brain uses indicates its metabolic activity. A seizure is a sudden uncontrolled onset of symptoms such as an epileptic seizure. An absent seizure or a petit mal seizure appears as a loss of awareness and an absence of activity. Tonic-clonic seizure or a grand mal seizure is characterized by muscle convulsions. Shingles is the appearance of painful blisters on the body along a nerve path. This is caused by varicella zoster virus or VZV. The virus initially enters the body during a chickenpox infection but becomes dormant in nerve cells, and then it's reactivated later in life, and it's called shingles. Spina bifida is the congenital defect in the walls of the spinal canal in which two sides of the vertebra do not meet or close, and it can result in a meningocele or a myelomeningocele. A spinal cord injury is the damage to the spinal cord from trauma. The spinal cord may be bruised or completely severed. A subdural hematoma is a mass forming of blood forming underneath the dura mater when the meninges are torn by trauma, and can exert a fatal pressure on the brain if the hematoma is not drained by surgery. Syncope means fainting. A traumatic brain injury, TBI, is damage to brain resulting from an impact, such as a car accident, blast wave, such as an explosion, or a penetrating projectile, such as a bullet. Symptoms can be mild, moderate, or severe and may include loss of consciousness, coma, headache, vomiting, loss of motor coordination, and dizziness. A transient ischemic attack, or TIA, is a temporary reduction of blood supply to the brain, and it causes temporary symptoms such as syncope, numbness, hemiplegia, and it can eventually lead to cerebrovascular accident. Okay, let's review some neurology abbreviations. AD for Alzheimer's disease, ADLs, activities of daily living, ALS, amyotrophic lateral sclerosis, ANS, autonomic nervous system, CNS, central nervous system, CP, cerebral palsy, CSF, cerebrospinal fluid, CTE, chronic traumatic encephalopathy, CT scan, computed tomography scan, CVA, cerebrovascular accident, CVD, cerebrovascular disease. EEG is an electroencephalogram or electroencephalography. HA stands for headache, and ICP stands for intracranial pressure. LP for lumbar puncture, MS, multiple sclerosis. NCS, nerve conduction study. NCV, nerve conduction velocity. PET, positron emission tomography. PNS, peripheral nervous system. SCI, spinal cord injury. TBI, traumatic brain injury. TIA, transient ischemic attack. And VZV, varicella zoster virus. Okay, now let's go on to endocrinology and learn to build some endocrinology medical terms. An adenocarcinoma is a cancerous tumor in a gland. Adenoid means resembling a gland. Adrenal means pertaining to the adrenal gland. Adrenomegaly is an enlarged adrenal gland. Adrenalectomy is the surgical removal of an adrenal gland. Adrenalopathy is an adrenal gland disease. Endocrinology is the study of the glands that secrete within. A tumor of the glands that secrete within is called endocrinoma. Glyco means sugar. Hyperglycemia is excessive sugar condition. Hypoglycemia is insufficient sugar blood condition. Glycosuria is a condition of sugar in the urine. Oophoritis is ovarian inflammation. Oophoroplasty is the surgical repair of the ovary. And orchiopexy is the surgical fixation of the testis. And orchiotomy is cutting into the testis. Ovarian means pertaining to the ovary. Ovariocentesis is the puncture of the ovary to remove fluid. Pancreatectomy is the surgical removal of the pancreas. Pancreotomy is cutting into the pancreas. Surgical removal of the parathyroid gland is parathyroidectomy. The state of insufficient parathyroid gland secretion is hypoparathyroidism. Pinealectomy is the surgical removal of the pineal gland. The state of excessive pituitary gland secretion is hypopituitarism. Polydipsia means many or too much thirst, and polyuria means many or too much urine condition. Testicular means pertaining to the testis. Thymic means pertaining to the thymus gland, and thymectomy is the surgical removal of the thymus gland. Thyromegaly means an enlarged thyroid gland. Thyrotomy means cutting into the thyroid gland. Hypothyroidism is a state of insufficient thyroid gland secretion, and thyroiditis is inflammation of the thyroid gland. All right, let's learn some other endocrinology-related terms. Acromegaly is a chronic condition developing in adults with excessive growth hormone, and it results in elongation and enlargement of bones in the head and extremities. Addison's disease results from hyposecretion of adrenocortical hormones. The symptoms include increased skin pigmentation, generalized weakness, and weight loss. Adrenal feminization is a condition of development of female secondary sex characteristics such as breasts in males because of increased estrogen secretion by the adrenal cortex. Adrenal virilism is the development of male secondary sex characteristics such as a deeper voice and facial hair in females due to increased androgen secretion by the adrenal cortex. A blood serum test is a blood test used to measure levels of substances such as hormones in the bloodstream. It's used to study the function of endocrine glands. Congenital hypothyroidism is a condition present at birth that results in the lack of thyroid hormone secretion, and it leads to poor physical and mental development. Corticosteroids, in addition to their normal functions, these hormones secreted by the adrenal cortex also have strong anti-inflammatory action and can be used to treat severe chronic inflammatory diseases such as rheumatoid arthritis. Cushing's syndrome is a condition resulting from hypersecretion of hormones by the adrenal cortex, and it can be a product of an adrenal gland tumor. Symptoms include weakness, edema, excessive hair growth, skin discoloration, and osteoporosis. Diabetes insipidus is a condition caused by insufficient secretion of antidiuretic hormone, or ADH, by the posterior gland of the pituitary, and the symptoms include polyuria and polydipsia. Diabetes mellitus, abbreviated DM, is a chronic disorder of sugar metabolism. Symptoms include hyperglycemia and glycosuria. Two different forms of diabetes mellitus are insulin-dependent diabetes mellitus, IDDM, or type 1, and non-insulin dependent diabetes mellitus, NIDDM, or type 2. Dwarfism is a condition of being excessively short in height and may be the result of hyposecretion of growth hormone. Exophthalmos is a condition in which the eyeballs protrude, such as in Graves' disease, which is commonly caused by hypersecretion of thyroid hormones. A fasting blood sugar, FBS, is a blood test to measure the amount of sugar in the bloodstream after a 12-hour fast. Gigantism is excessive body growth due to hypersecretion of growth hormone in children or teenagers. A glucometer is a device used for diabetics to monitor levels of blood glucose in their bloodstream. A glucose tolerance test, GTT, is a test for the initial diagnosis of diabetes mellitus. The patient is given a dose of glucose, and then the blood samples are taken at regular intervals to determine the patient's ability to use that glucose properly. A goiter is an enlargement of the thyroid gland that's not caused by a cancerous tumor. The most common cause of goiter is a diet that's poor in iodine. Iodine is essential for the production of thyroid hormones. The thyroid gland increases its size in an attempt to produce more thyroid hormone, even though it's unable to do so. Graves' disease is a condition resulting from hypersecretion of thyroid hormone. Symptoms include exophthalmos and goiter. Hashimoto's thyroiditis is a chronic autoimmune condition that gradually destroys the thyroid gland, and it results in hyposecretion of thyroid hormones. Hormone replacement therapy is the artificial replacement of hormones in patients with hyposecretion disorders. It's available in pill injection or adhesive patches on the skin. Insulin is a medication to replace insulin in persons with type 1 diabetes or to treat persons with severe type 2 diabetes. Insulin-dependent diabetes mellitus, or IDDM, is also called type 1 diabetes mellitus, and it tends to develop early in life. The pancreas stops producing insulin, and it can be autoimmune disease. The patient usually has to take insulin injections, or they can be hooked up to a pump like seen here. Myxedema is a condition resulting from hyposecretion of thyroid hormone in adults. The symptoms include anemia, slow speech, swollen facial features, puffy and dry skin, drowsiness, and mental sluggishness. Non-insulin dependent diabetes mellitus, abbreviated NIDDM, is also called type 2 diabetes mellitus, and it typically develops later in life. The pancreas produces normal to high levels of insulin, but the cells fail to respond to this. The patient may have to take medication to improve insulin function. Oral hypoglycemic agents, the medication that's taken by mouth to decrease blood sugar levels in persons with type 2 diabetes. It's not used to treat people with type 1 diabetes. Pheochromocytoma is usually a benign tumor of the adrenal medulla that causes excessive secretion of epinephrine. Symptoms include anxiety, heart palpitations, dyspnea, profuse sweating, headache, nausea, and hypertension. Radioactive iodine uptake, RAIU, is a test of thyroid function that measures how much radioactively tagged iodine is removed from the bloodstream by the thyroid gland. A radioimmunoassay, or RAA, is a test used to measure levels of hormone in the plasma of the blood. Tetany is nerve irritability and painful muscle cramps resulting from hypocalcemia. Hypoparathyroidism is one cause for the low calcium levels. Thyroid function test, TFT. It's a blood test to measure levels of thyroxine, triiodothyronine, and thyroid stimulating hormone in the bloodstream. This is used to evaluate thyroid function. A thyroid scan is a test in which radioactive iodine is administered and it localizes to the thyroid gland. The gland is visualized with the scanning device and used to detect thyroid gland tumors. Thyrotoxicosis is a condition resulting from extreme hypersecretion of thyroid hormones. Symptoms include a rapid heart action, tremors, enlarged thyroid gland, exophthalmos, and weight loss. Okay, let's review some endocrinology abbreviations. ACTH stands for adrenocorticotropic hormone, ADH, antidiuretic hormone, DI, diabetes insipidus, DM, diabetes mellitus, FBS, fasting blood sugar, FSH, follicle stimulating hormone, GH, growth hormone, GTT, glucose tolerance test, HRT, hormone replacement therapy, IDDM, insulin dependent diabetes mellitus, K plus stands for potassium, LH, luteinizing hormone, MSH, melanocyte stimulating hormone, Na plus, sodium, NIDDM, non-insulin dependent diabetes mellitus, NPH, neutral protamine hagadorm, or insulin, PRL, prolactin, PTH, parathyroid hormone, RAIU, radioactive iodine uptake, RAA, radioimmunoassay, T3 is triiodothyronine, T4, thyroxine, TFT, thyroid function test, and TSH, thyroid stimulating hormone.